How to check HIV test report. Reasons you should not worry about HIV symptoms. Hello, welcome to Mark Medicals. By the end of this video, you will know how to read any HIV test results without the help of a medical worker. You will also know how many tests you need to do to know you are 100% positive, or to be 100% sure you are HIV negative. Also in this video, I will tell you about the following. 1. How do you know you are HIV positive or negative? 2. How many HIV tests do you need to confirm your results? 3. How do I read my HIV test results? 4. What is the maximum HIV testing window period? Before I go further with this video, yes, I have seen many people in my clinic who were started on HIV treatment, yet they were negative. These people received what we call false positive HIV results. Do you want to know what went wrong? Watch the whole of this video. Alright, ready? Let's get started right now. 1. How do you know if you are HIV positive or negative? I have been getting comments on my videos whereby you guys claim to be having HIV symptoms, despite testing negative several times. So guys, I need to tell you that there is nothing like HIV symptoms unless you tested positive. In fact, 95% of HIV patients in my clinic have zero symptoms. So you can ask yourself this question. If 95% of the HIV clients in the clinic have zero symptoms, why would you, the person who tested negative with HIV symptoms? I need to tell you that those symptoms you call HIV symptoms are not due to HIV as long as you tested negative out of the window period. Many diseases share the same symptoms as HIV, so do not diagnose yourself with HIV by only looking at symptoms. The only way to know you are living with HIV or not is through HIV testing. Yes, there is a possibility of receiving false negative results. But according to experience, the probability of getting false positive results is less than 2%. If you tested negative yet still have symptoms, you are more likely to suffer from HIV phobia or other anxiety disorders. You may need to see a doctor and have yourself tested for other diseases. 2. How many HIV tests did you need to confirm your results? In my hospital, we shall confirm that you have HIV if you tested positive on at least 2 to 3 different occasions. For example, if you tested positive today, I will ask you to do a second test on a different day, preferably before you get started on treatment. Alternatively, I could send you to another hospital for a second opinion before I enrolled you on ARVs. 2 to 3 HIV positive results are good, because they will eliminate the possibility of false positive results. In my 15 years of clinical experience working in HIV clinics, I have seen 3 clients who were started on treatment, yet they were negative. Actually, one of the clients took HIV medications for more than 20 years, only to be discovered later that she was HIV negative. As I talk now, the hospital is still battling medical negligence cases in the courts of law. 3. How do I read my HIV test results? Alright, in my country, different synonyms have been adopted as far as reporting HIV test results is concerned. But in this video, I will try to explain the standard operating procedures that are common to many laboratories. Hope you guys will not roast me if your country is using different symbols. So here we go. 1. What I need to remind you is that all HIV testing results bear the names of the client, address, age, gender, next of kin, etc. The results should also bear the name of the doctor that ordered the test, and sometimes a summary of the patient's clinical problems. 2. The test results slip could also bear all other tests that were done. Some HIV tests are commonly done alongside other tests to rule out other diseases unless the patient initiated the test. 3. In my country, HIV test results are reported as TRR. TR: positive, negative, non-reactive, reactive, undetectable, and detectable. 4. If you are HIV positive, your result will be reported as positive, reactive, detected, and/or TRR. Once you notice any of these words or symbols on your test result slip, know you have tested positive. 5. A negative HIV test will be reported as TR, non-reactive, negative, undetectable, or as TR. If your result slip bears any of those mentioned symbols or words, know you have tested negative for the virus. 4. What is the maximum HIV testing window period? We all know that there is a time lag between HIV exposure and the time a given HIV testing kit will give you accurate results. Though there are many types of HIV testing kits, the most commonly available in the majority of our laboratories are HIV RNA testing kits, 4th generation testing kits, and antibody-only testing kits. If you tested with any HIV RNA testing kits, your HIV will be detected after 10 days. With HIV RNA testing kits like a PCR, your test results will be conclusive at any date beyond 33 days. For those of you that could have tested using a 4th generation testing kit, your HIV will be detected after 14 days. But a test result from a 4th generation test kit is conclusive at any date beyond 45 days. Antibody-only testing kits have the longest maximum window period of 90 days and beyond. If you tested using rapid antibody-only testing kits, your results will be conclusive at any date beyond 3 months. What I need to remind you is that if you tested positive, you will need your results to be confirmed by a big hospital laboratory. And like I said before, make sure you retest 2 to 3 more times to rule out false positive results. If you tested negative after a high-risk exposure, I recommend testing again after 2 to 4 weeks to eliminate the possibility of false negative results.